Hi everyone. Today I'll be discussing a drug which is known to everyone, that is 2-deoxy-glucose oral powder. Now everything is known what I'm going to tell in this video. In this video we'll be discussing the scientific background, what the media is claiming, what the government is claiming, is it true? Will that improve the patient so much? Let us analyze the drug and then come back to the conclusion why this wonder drug is being projected so high. So let us hope this drug will be a miracle drug. So the drug is 2-deoxy-D-glucose oral powder, and it is developed by Dr. Reddy's laboratories, and it is developed in collaboration with DRDO, that is the Defense Research and Development Organization. It is a simple glucose powder where the OH group is being removed and replaced with only H. So that I will discuss later. So the drug is 2-deoxy-D-glucose, we simply read as 2DG. Right? Now you have seen in the media, you can see here breaking news. So I'm not going to break any news. Now they have asked a question, is 2DG a new game changer? Now they have claimed that 42% of patients are off oxygen support after 2 sachets of this 2D glucose. Is it true? What do they mean by that 42% patients are off that oxygen support after 2 sachets? The extremely great news, that is 42% of patients are off this oxygen support after just 2 sachets. Now how the drug works, we'll come to that later. Now you have seen this TV advertisement, this is the sachet, and you have seen this also, you can see in this image, this petri dish where there is virus SARS-CoV infection. After 2D glucose, the viral multiplication has disappeared. And what has happened here? Let us analyze that. And you can see here, this was released by the health minister, and you see these images that 2D glucose is stopping the multiplication of virus. Now let us analyze this in a scientific manner. Now let us analyze this with the questions. What is the meaning of 2-deoxy-glucose? What do you mean by that? What is the difference between glucose and 2-deoxy-glucose? You know from your first year MBBS that D-glucose, you have this structure here, and we coin these places as 1, 2, 3, 4 like that. Now this glucose, what we use is dextroglucose, that is D-glucose, and here you can see that it has OH at the second position. Now what is 2D-glucose? Is nothing but 2-deoxy means we have removed that oxy group, and this 2-deoxy-D-glucose doesn't have that OH group, only H. So that's the reason deoxy, the oxy is removed, it is only H, that's why it is called 2-deoxy-D-glucose. Right? So we understood what is that molecule, how it is being done. Now was this drug used before? That is another question. Was it used before in any other condition, 2D glucose? Yes, it is in research for cancer therapy from 1980s. Even in 1920s the interest was there. In 1980s the treatment for cancers, this 2D glucose was used. Now whenever we treat a cancer cell, we are also damaging our normal dividing cells. We are also damaging our normal dividing cells. For example, if I give an anti-cancer drug which stops the multiplication, so this anti-cancer drug doesn't differentiating the normal dividing cell and the cancerous cell. So it will go and inhibit both the normal cells as well as cancer cells. That is the problem we face with cancer therapy. So that's why scientists try to find out some peculiarity for this, something called cancer cells or proliferative cells or virus infected cells. Now we have to fool these cancer cells, we have to fool this virus. So one example I will give you, there is a drug called L-asparagine which is used for leukemia. Now L-asparagine, as the name itself tells you that it's a enzyme. L-asparagine obtained from E. coli. Now the normal cells, when they multiply the normal cells, what can the normal cells do? They can synthesize asparagine on their own. The normal cells can synthesize on their own. Compared to that, the cancer cells, they have to take L-asparagine from outside. So because they are multiplying very rapidly, they want to multiply very fast, so they try to take up this L-asparagine from outside. Now, if that is not there, the protein synthesis will not occur properly. Now, that's why we use an enzyme L-asparginase which goes and cut this. That means it will destroy that. And because of that, the cells will not multiply so fast compared to the normal cells. So, this is one of the basics what we have. Similarly, we have fooled a virus. We have given fake nucleosides, fake purines, fake pyrimidine. The examples are acyclovir, which is used for herpes simplex virus. We have zidovudin, which is used for treating HIV. So what do we do here? We use the fake purines, fake pyrimidines, and when the virus which is multiplying very fast, they take them into their cell and they will make it triple phosphorylated and they will stop the DNA replication. So we have fooled the virus also. Now, can we have something with the COVID-19 also? Can we have something with COVID-19 also? Let us see. Now, how the drug works in COVID-19, how this drug, that is 2D glucose, works in COVID-19. Can we fool this? Can we fool this virus? Can we cheat this virus? Simple words. Can we cheat that? So, to understand how to cheat that, understand pathophysiology. How this COVID-19, you know this, all this pathophysiology, it enters into the lungs and it will mount an immune response, all those things, you know that. So in simple languages, I want to tell that when the virus enters the lung, what happens? The virus infects the lung cells. The virus infects the lung cells and also mounts an immune response. These are the two things that happens when it enters the lung cells. Now the infected lung cells, they adapt their metabolism. Why do they adapt their metabolism? Because when the virus enters through the spike protein, inside the lung cells, the virus need to replicate very faster. It has to replicate very faster. Now, if the virus has to multiply very faster, the cells have to adapt for metabolism. What is the metabolism that will get adapted? There is increased glycolysis. Why there is increased glycolysis? Because glycolysis is the one which gives more and more energy for this process, and also it gives intermediates. The intermediates like ribose, which is required for the DNA and RNA synthesis. So that is required for viral replication. And also when you metabolize glucose in such a high amount, the oxygen demand also increases. That is the pathophysiology in a viral infected cell. So here what is going to happen is the metabolism in these cells, the infected lung cells, is going to be upregulated, so increased glycolysis. Now coming to the immune response, even in macrophages and monocytes, these are the one which play a key role in COVID-19 pathology. They also adapt their metabolism and they also activate mitochondrial ROS production. All of them make these cells highly glycolytic. So here also there is increased glycolysis and increased oxygen demand. That creates oxygen demand. So two ways the virus enters the cell and penultimately it creates more and more oxygen demand for its own replication. Why it is required? So that the virus multiplies very faster. Now let us trick the virus. Let us cheat the virus. So for all this glycolysis, it requires glucose. Now whenever there is high demand, what happens in virus infected cell? There is high metabolic demand. So it will take glucose and enters to the GLUT transporter, and glucose will become glucose 6-phosphate, fructose 6-phosphate. You know from biochemistry, the conversion is done by exokinase and phosphoglucoisomerase, and this will lead to glycolysis and energy metabolism, which are required for viral application. Now, is it that enough? So this is what happens, and the glycolysis increases inside the cell. Now, please come back. There is one more theory that has been put forward. What is that put forward theory is? Now, compared to the differentiated cells, that is the normal cells, there is a difference between proliferative tissue or tumor cells, that is cancer cell. Proliferative tissues are nothing but these are the monocytes or lymphocytes and also the infected cells. So what is the difference of utilizing glucose here? In differentiated cells, the glucose, if it is present, it will be converted to pyruvate and it will go for oxidative phosphorylation. You know the from biochemistry. In absence of glucose, the pyruvate becomes lactate and it will lead to anaerobic glycolysis. Now, the difference with infected cells or proliferative cells or tumor cells is even in the presence or absence of glucose, they always convert glucose majority into lactate. Now, why do they make like that lactate? Now, they don't want to utilize this pathway, aerobic glycolysis. They want always 85% into the lactate. And this effect is called Warburg effect. So, in proliferative tissues or infected cells, these glucose, what is present, which is taken up fast, that will be converted into lactate. Now, this conversion will produce intermediates. So, this will produce intermediates. So, more and more intermediates are produced, and these intermediates are required for viral replication. So, see the beauty of virus. So that it will not allow the glucose to be utilized as energy, but what it will do, it will utilize the intermediates which are required for viral replication. So a simple thing I will have represented here is the glucose will become glucose 6-phosphate and it will become ribose. Ribose is required for DNA and cycle proliferation, particularly in cancer cells. Similarly, the intermediates are also required for viral replication. So the intermediates are also required for viral replication. So this is what we see with the cells. Now you understood the pathophysiology. So glucose is the key thing. Now they require more and more glucose. One is to obtain energy. Second one is to get intermediates so that it will multiply faster. So I need to cut down this glucose. If I cut down this glucose, it requires lesser oxygen. What to do now? What I can do now is, instead of glucose, what I have to do is, how the drug works, I will give a fake one. Who is a fake one? That is 2D glucose. I will cheat this virus cell that telling that I have given you 2D glucose, you take it. So whenever we give 2D glucose, the virus infected cells, they have high metabolic demand. But compared to that, normal cells have lesser uptake because they don't have an elevated metabolic demand in the situations. Now, when we give 2D glucose, the virus infected cells, they try to take glucose inside for the energy process. But same time, the 2D glucose also try to enter inside. So there is a competition for the entry. So that's why the glucose will not enter. Now, when the glucose enters inside, the 2D glucose will also be converted into 2D 6-phosphate. Now once this is done, this will not be converted further. Now this 2D glucose 6-phosphate can inhibit hexokinase and also it can inhibit phosphoglucose isomerase. Now the excess of demand of glucose that was required is not now met. So they don't have more glucose to utilize. Now this step is stopped. So when you are not utilizing more and more glucose, obviously the oxygen demand comes down. So the metabolism comes down, the oxygen demand comes down. So this is one of the process. Second one is this 2D glucose, it also inhibits viral replication. Why? Because it will not allow the synthesis of intermediates. And one more thing what they have proposed for this is it interferes with N-glycosylation of viral proteins. Now viral proteins, to become infective, they should undergo N-glycosylation in endoplasmic reticulum. And if that is not done, so there will be misfolding of viral glycoproteins. The virus become non-virulent. We call that them as virions, and it will become non-infective. If it is becoming non-infective, you are not going to synthesize more and more COVID virus. So this viral replication stops, and they will not infect a fresh lung cell. So this is how it has antiviral property. It also decreases the oxygen demand. So this is the proposed mechanism. Now I have represented this again here for you. If I give 2D glucose, it will be converted to 2D glucose 6-phosphate, which inhibits hexokinase and this phosphoglucose isomerase. Now this is why the glycosylation will not occur properly, and also the intermediates are not formed. So that will also inhibit viral replication. So this is a complex mechanism of action which is going to work. Now the question is, will not the normal cells be affected? Yes, it may be affected, but not much extent, because this 2D glucose is taken up by highly metabolic demand cells, that is monocytes, macrophages, and lung cells. Lung cells particularly take up this 2D glucose. So that's the basis for PET scan. If you do PET scan, we give this 2D glucose and we do the scanning where this glucose uptake will be high. So this is one of the bases. Now, with that background in the mind, you understood the mechanism of action, how it reduces the oxygen demand. So these are all theory. These are all the proposed mechanism. Now, did the drug really work? So that will be done. That will be understood by taking this concept. Are there clinical trials done? Were they done with the clinical trials? Yes, this drug was done in clinical trials. Phase 2 trial was done in 110 patients. Which are the patients who were taken up for this? They were having moderate to severe COVID-19. It was conducted between May to October 2020. Last year only it was done. Now, when this was done, the recovery rate was faster compared to the standard of care. What is standard of care? It is nothing but giving the standard, the steroids, the remdesivir, then the low molecular weight heparin, and a symptomatic treatment. So that is called standard of care. For that care, if you are adding the 2D glucose, the recovery was 2 to 3 days faster compared to only standard of care. So that was done. So when this result was obtained by Drug Control General of India, then they approved for the second phase 3 trial. Now, phase 3 trial was undertaken between December 2020 to March 21. That is, even the second wave was not started, then it was started. So it was carried out in 220 patients in multi-centers, not only in Karnataka, not only in Delhi, so many medical colleges or some hospital it was done. So there were two group of patients, group A and group B. And group A, they were given 2D glucose plus standard of care, and group B only standard of care. So they compared these two things, and when the data came, 42% in group A improved. How did they improve? They had very good symptomatic improvement, that is the breathlessness or the fever, the tiredness, and also they became free from supplemental oxygen therapy, that is 42%. Compared to group B, where there was only 31%. So what the media, what the people are claiming, this 42% means if we have 100 people here, 42 people became like this, and in this group only 31 people came like this. But scientifically speaking, what is the only difference? Here it is 42 people, 31 people, only 11 people had more improvement compared to the standard of care. Now, we cannot come to a conclusion scientifically with only this much patient, 220 patients. Critically, if I want to acclaim, there is a value called p-value, and this value should be significant. To make that p-value significant, the number of patients should be very, very high. So since it's a pandemic, we are in emergency situation, we cannot go with that much of patient, we cannot wait for that. So that's why the DCGI, Drug Control General of India, he approved this. Now, is it approved? Yes, it was approved by Drug Control General of India. When it was approved, 1st May 2021, under emergency use authorization. So emergency use authorization means emergency like pandemic. It's not for emergency. It's not the emergency what we see in the emergency room. It's a emergency use. The emergency is pandemic. Because of that, it is approved so early. Now, who developed it? It is by INMAS, that is Institute of Nuclear Medicine and Allied Health Sciences, and in association with DRDO, which comes under this, and the pharma company which is collaborating is Dr. Reddy's Laboratories. They are the one who developed it. Now, is it safe? That second question is it safe? Now, they have checked in 176 patients. It has shown no serious adverse events at all, no serious adverse event, but they have found out there is maximum tolerated dose. If you are using 63 mg per kg per day in a patient, some patients they have experienced QT prolongation, and you should be careful with the dosage. Not more than this should be given. So that is the maximum tolerated dose. No serious adverse event has been reported till now in the trials. So it is comparatively safe. So first thing is whether it will work. Second thing is whether it is safe. But patient will not ask that. First, he will ask whether it is safe. Yes, it is safe. Whether it will work or not is a secondary thing. Now, how this is available? How this is available? Is it a tablet? Is it a powder? It is a powder. It's a powder sachet, comes under two strengths, 5.85 gram as well as 2.34 gram. Now, this sachet contains white colored granular powder. These are filled in laminate made up of glassine paper or low density polyethylene aluminum foil. Now, this is only to protect the drug from moisture, and storage condition is usually room temperature, that is 25 degrees Celsius. But in certain conditions, or when you are transporting it, that even 15 to 30 degrees Celsius can be maintained. So this is about the maintenance conditions. Now, how it is administered? Now, the drug is simply dissolved in a water, 100 ml of water, potable water, not only filter water, any potable water which is suitable to drink, dissolve in 100 ml of water, and then it is taken in empty stomach. Now, what is the dosage? It is 45 milligram per kg twice daily up to 10 days. It doesn't mean that you have to take up to 10 days. Up to 10 days, you can take it for 2 days, 3 days. If there is improvement, then it can be stopped. So, up to 10 days means it doesn't mean that you have to take for 10 days. So, 45 milligram per kg twice daily. So, that is the dosage. So, this is what I came up with this video to tell you scientifically how the drug works. What do you mean by 2D glucose? Now, how it is administered, how it is available, how to take the drug. So, the question arises whether the drug works or not. So, scientifically speaking, because I am a member of ethics committee and I am a pharmacologist by profession, so for us, we require scientific data. We require larger population. We are worried what happens to the normal cells. But according to theory, it is affecting only the tumor cells and the infected cells. They are going to take up this 2D glucose more and more. So it's all theory. So for us, we require concrete data. But as of now, we should believe. Let us believe that this drug is a miracle drug, and this will make the patient recover faster. And this is being done in trial with moderate and severe patients who are oxygen dependent, who are serious, and it has shown some miracle. So let us hope that this miracle happens more and more. Let's not go into the scientific depth of this drug. Let's go and pray that this drug works for all of us. So let me end with this. Faith consists in believing when it is beyond the power of reason to believe. So that's what we will put a faith on this miracle drug. Let this wonder drug become magic bullet for COVID-19. Let's beat this pandemic. Thank you all. Take care. Be safe.